The purpose of this video is to give an overview of how the medication buprenorphine works and to give an introduction to how to use buprenorphine in your recovery. The first thing to know about buprenorphine is that it prevents opioid withdrawal. Just by taking the medication, it can reduce the symptoms of withdrawal without giving the experience of euphoria or getting high. One of the other benefits of the buprenorphine medication is that it can actually prevent craving for opioids. What makes buprenorphine special is that it has a ceiling effect, which means that no matter how much buprenorphine you take, you can't overdose on the medication. Also, buprenorphine has a blocking effect, which means that when you take a full therapeutic dose of buprenorphine each day, then you won't be able to get high or overdose on other opioids during that day. For this reason, it's really important to know how to take the buprenorphine correctly as a once-a-day medication. Buprenorphine is different than other opioids like oxycodone or heroin that only last for 6 to 8 hours. Buprenorphine has a long half-life, meaning that it can last 24 to 48 hours in some cases. In order to get a full blocking effect from the buprenorphine medication, you need to take it all at once so that you can get the highest levels of buprenorphine onto the opioid receptors in the brain. Once buprenorphine is on the opioid receptors in the brain, it blocks other opioids from being able to get to them and being able to give you a feeling of getting high or to be able to cause respiratory depression, which leads to overdose. Another reason to take buprenorphine once a day is that it can avoid the stress cycles that are often caused by other types of opioid use. Every time you take an opioid and then go 6 or 8 hours again into mild to moderate withdrawal and then take the opioid again, that creates stress on your body and your brain, which can lead to adverse health conditions, abnormal menstrual cycles, as well as anxiety and depression, as well as craving. Therefore, if you can take the full dose of buprenorphine all at once at the beginning of the day, then you can avoid those stress cycles and actually the body and brain can begin to heal. It's important to work with your doctor to find the dose that's right for you. In general, in my practice, we work to be able to find what dose can help people to avoid any withdrawal symptoms from the time they take it in the morning until the time they wake up the next day, after getting a good night's rest and without having craving or withdrawal symptoms. In general, it takes 4 or 5 days for people to adjust to a new dose change with buprenorphine, so wait that time to see if the new dose will be right for you. There are several formulations of buprenorphine where it's mixed with naloxone. The most common formulations are called Suboxone or Zubsolv. And the Suboxone comes in 2 different versions, tablets and films. In general, the Suboxone films dissolve faster. Both the Suboxone film and the tablet have an orange taste, where the Zubsolv, which also dissolves faster, has a minty flavor. When you take the buprenorphine naloxone, you take it sublingually, which means it's placed under the tongue so it can absorb into the oral mucosa. Buprenorphine can also be absorbed in other areas of the oral mucosa, such as on the inside of the cheek. In order to get the most out of the medication, you want to maximize the bioavailability of the medication, which means you want to be able to make it as available as possible to the blood, the body, and the brain. In order to do that, it's most important to not eat, drink, or smoke for 15 to 30 minutes before and 15 to 30 minutes after taking the medication. This is because buprenorphine is not as bioavailable and doesn't absorb when the mouth is in an acidic environment. Many people wonder why the medication is called buprenorphine naloxone and what does this naloxone do? Actually, the naloxone doesn't do much of anything when you take the medication correctly sublingually. The naloxone is there to prevent diversion, and if somebody were to inject or snort the buprenorphine, then they would get naloxone, which is a antagonist medication, which means that it takes all the opioids off your opioid receptors and throws you into withdrawal. Naloxone is also well known as the intranasal medication Narcan that is used to reverse overdoses. Starting buprenorphine can be tricky and complex, which is why originally in-office induction was the only way to start buprenorphine. Now, because so many people have had exposure or experience with buprenorphine, home induction is something that is possible, and an observed dose is often required by your treatment program in order to help you to find the dose that's right for you. Overall, buprenorphine and naloxone is very safe, with very few contraindications. The most important thing to be aware of is to avoid precipitated withdrawal. If somebody is taking the medication and is not already having symptoms of mild to moderate withdrawal, then the medication can throw them into full-scale withdrawal that can last for 24 hours and be very hard to reverse. So it's very important when you're starting buprenorphine to ensure that you already are in mild to moderate withdrawal. Another key safety concern is the risk of mixing buprenorphine with a sedative medication or substance, such as a benzodiazepine like Klonopin or Xanax or Ativan, or even alcohol. As I mentioned earlier, buprenorphine has a ceiling effect, meaning that by itself it will not lead to respiratory depression or overdose. But when it's mixed with sedating medications, there is a synergistic impact which takes away the ceiling effect and overwhelms it. Other common side effects include constipation and sweating. While buprenorphine alone is a safe medication during pregnancy, it is crucial for women of reproductive age to know that they are much more likely to get pregnant once they start buprenorphine treatment. So birth control is important to consider if you do not want to be pregnant. If you're taking buprenorphine, naloxone, and you get pregnant, it is essential that you speak to your prescriber so that you can switch from the buprenorphine naloxone version to buprenorphine alone, which is the version that's safest in pregnancy. It is important to know that medication alone is not treatment. That medication sets the stage and allows you to be able to engage in the treatment that you need so that you can deal with the aspects of your life where you're suffering and to be able to make the changes you need to open up, to have greater health and joy in your life. The most important aspect of recovery is living with honesty and authenticity. So find out what your program rules are and really do your best to be honest with the treatment team and work the program authentically. When you follow the program rules, you not only help support your own recovery, but you help keep yourself safe and keep others safe as well. For most people, buprenorphine is a maintenance medication, meaning they'll be on it for many years or for life. Other options do exist for medication-assisted treatment. One option is methadone, which can be particularly helpful for people who can benefit from the daily structured support of methadone maintenance. Some people find the idea of a maintenance medication as difficult to accept when they're early in recovery, even though all the scientific evidence supports the use of buprenorphine, naloxone, as an effective treatment for opiate use disorder that reduces overdose, reduces relapse, and helps people feel happier and healthier in their lives. A recent study showed that Vivitrol can be as effective as Suboxone as long as you're able to make it through the difficult and challenging 7 to 10 day period of abstinence that's required in order to start that medication. Some people decide to go to detox and residential treatment in order to be able to get that period of abstinence and then come out on the medication naltrexone. Thousands and thousands of people have entered into long-term recovery by taking buprenorphine naloxone as a maintenance medication. One of the things that can get in the way of this is stigma. Stigma is the negative judgments that might come from family, friends, community, or even from ourselves about the fact that we may have had an addiction or that we're on a medication to help us with recovery. In some cases, people let stigma get in the way of their accessing what we know is scientific evidence-based treatment that has saved so many lives. If you approach recovery in an honest, open, and authentic way, and you accept yourself and your situation for what it is, then you can overcome that stigma and it'll lose its power, and you'll be able to get the most out of this medication and your recovery. The curious paradox is that when I accept myself just as I am, then I can change.